What is cardiovascular disease? The cardiovascular system consists of the heart, blood vessels, veins, arteries and capillaries, and blood. The cardiac cycle consists of two phases: systole, the relaxation of the heart muscle, and diastole, the contraction of the heart muscle. The primary function of the cardiovascular system is to transport nutrients and oxygen-rich blood to all parts of the body and to carry deoxygenated blood, which is lower in oxygen, back to the lungs. As the body ages, the heart functions less effectively. The arteries also have a higher likelihood of becoming stiff with age. A disease is a disorder that has a known cause and a distinctive group of symptoms, signs, or changes in bodily function. Cardiovascular disease is a name for a range of conditions that affect your heart or circulation. There are four main types of cardiovascular disease. These include coronary heart disease is a condition where the major blood vessels supplying the heart are narrowed, reducing blood flow. Heart disease also covers conditions that affect your heart's muscle, valves, or cause abnormal rhythms. Strokes occur when the supply of blood to the brain is reduced or blocked completely, which prevents brain tissue from getting oxygen and nutrients. A transient ischemic attack, TIA, is known as a mini-stroke, but blood flow to the brain is only temporarily disrupted. Aortic disease. The aorta is the largest blood vessel in the body, which carries blood from the heart to the rest of the body. An aortic aneurysm is where the aorta becomes weakened and bulges outwards. It has no symptoms but could burst and cause life-threatening bleeding. Peripheral arterial disease is when there is a blockage to the limbs, usually the legs. This can cause leg pain, which is worse when walking and gets better when you rest. Other associated conditions with cardiovascular disease include high blood pressure. Vascular dementia is a condition caused by the lack of blood that carries oxygen and nutrients to part of the brain. It causes problems with reasoning, planning, judgment, and memory. A heart arrhythmia is an abnormal heart rhythm that is too quick, too slow, or has a distinctive pattern. Symptoms may include skipping beats, dizziness, fainting, chest pain, shortness of breath, sweating. Heart failure occurs when the heart is unable to pump enough blood to satisfy the body's needs. Some symptoms include persistent coughing or wheezing, shortness of breath, increased heart rate, nausea, sickness in the stomach with an urge to vomit, lack of appetite, swelling, fatigue, feeling uncomfortable, ill, or lack of energy, but you cannot explain the cause. Confusion. A risk factor is something that increases the chance of getting a condition. Even if you can't change all your risk factors, there are steps you can take to reduce your risk. Smoking and other tobacco. Stress over an extended period can lead to high blood pressure, which increases the risk of heart attack and stroke. Alcohol. Excessive alcohol consumption can increase your cholesterol and blood pressure levels and contribute to weight gain. Diet. An unhealthy diet can lead to high cholesterol and high blood pressure. High blood pressure. If your blood pressure is too high, it can damage your blood vessels. High blood cholesterol. Cholesterol is a fatty substance found in the blood. If you have high cholesterol, it can cause your blood vessels to narrow and increase your risk of developing a blood clot. Being physically inactive. Exercising regularly will help keep your heart healthy. When combined with a healthy diet, exercise can also help you maintain a healthy weight. Being overweight or obese. You are at an increased risk of heart disease, CVD, if you are a male with a waist measurement of 94 centimetres or more, or a female with a waist measurement of 80 centimetres or more. Diabetes. High blood sugar levels can damage the blood vessels, making them more likely to become narrowed. Family history. If either your father or brother were diagnosed with heart disease before they were 55, or your mother or sister were diagnosed before they were 65 years. Ethnic background. In the UK, people of South Asian and Black African or African Caribbean background have an increased risk of getting CVD. Sex. Men are more likely to get CVD earlier than women. Age. As a person ages, their heart begins to work less effectively than it used to. Another common condition of aging is more stiffness in the large arteries and stiffness of the heart muscle. Treatment will depend on your condition, but usually includes lifestyle changes, medication, a device such as an ICD or pacemaker, stents, heart surgery.